Our visitors in the gallery and stakeholders, and just to indicate to yourselves that during the proceedings, you are not allowed to participate in the debate, so you do not clap hands or shout or whistle or take photos, whether with your camera or with your cell phone or with your iPad. You are not allowed, but you can smile, it's fine. You're most welcome. Thank you very much. The Secretary will now read the order.
Debate on vote number 16, Health Appropriation Bill.
And I call upon the Honorable Minister of Health.
Thank you, Honorable House Chair, my cabinet colleagues and Deputy Minister Dr. Joe Phaahla, Chairperson and members of the Portfolio Committee, honorable members and our development partners, good afternoon. It gives me a great pleasure to present to the 2018-19 budget to this House and to outline our plans for 2018-19 financial year. This year, we honor the memory of our beloved Madiba, who will have celebrated his 100th birthday. In the same vein, we also honor Mama Albertina Sisulu, who will also have turned 100 this year. They were both fighters for equality and social cohesion, and so shall we conduct this budget debate in that manner in order to honor them. In this budget speech, I wish to extensively elaborate on 3 issues that President Cyril Ramaphosa flagged in the January 8th statement delivered at the celebration of the birth of the ruling party, the African National Congress, and repeated during the 2018 State of the Nation address. The first thing he said was that, and I open quote, "We will intensify efforts to improve the health of our people, particularly in the context of the devastating impact of the AIDS epidemic and the emergence of other diseases. As South Africans, we must never accept as permanent or irreversible our status as the country with the world's largest and biggest HIV epidemic. We need to take decisive steps to bring an end to the epidemic through systematically implementing the 1990 strategy, which will entail, among others, the addition of 2 million more people on our antiretroviral program," close quotes. The catchwords here, Honorable Chair, is an end to the epidemic, and secondly, systemically implementing the 1990. Honorable Chair, in taking the President's instructions forward, we shall do everything in our power to take the initial steps towards bringing this epidemic to an end. Since 2009, we have made significant strides in dealing with the HIV epidemic, possibly the greatest contributor to morbidity and mortality our country has ever seen since World War II. Of the estimated 7.1 million people living with HIV in our country, we have more than 4.2 million people who are on treatment. This makes it the world's biggest treatment program. Scientists have already informed us that people on treatment who are virally suppressed do not transmit the virus. They further inform us that if 90% of people who are on treatment get virally suppressed and remain so, that will be the end of the epidemic. Hence, we need to drive our strategies in that direction, the direction of viral suppression. In this regard, President Ramaphosa will launch in the month of June, the Youth Month, a national search campaign that will screen 14 million people for HIV and TB. This campaign will seek to target South Africans who do not know their HIV status and those who do not know that they've got TB. Once people are screened and tested, they will be offered appropriate treatment. This campaign will focus on providing information to ensure that people who are negative stay negative. South Africa has signed up to the UN AIDS target of reaching 90-90-90 for HIV by December 2020, as well as the Stop TB Partnership's targets of 90-90-90 for TB. This target simply means that to bring an end to these two diseases, we must find 90% of those that are HIV positive and those that have TB, initiate 90% of this on treatment and ensure that 90% of those who are on ARVs are virally suppressed and 90% of those on TB treatment are successfully cured. We have partnered with PEPFAR program to develop this plan, which we call the Search Campaign, to find 2 million people who are HIV positive and put them on treatment. And this must be achieved by December 2020. We then have to keep them virally suppressed forever. And this is called the 1990 plan. As can be seen, it's a very ambitious plan. To fund it, Treasury has added an extra 2.3 billion rand to the HIV conditional grant. In addition, PEPFAR has agreed to make substantial additional contributions to this HIV treatment program. In addition, we need to find an estimated 80,000 people who have TB that are either not diagnosed or diagnosed but not on treatment, and we need to get them back on treatment. I call on all stakeholders to partner with the Department of Health and the South African National AIDS Council to ensure that the campaign as well as the search program are successful. Secondly, Honorable Chair, President Ramaphosa also said, and I quote him again, we will also need to confront lifestyle diseases such as high blood pressure, diabetes, cancer, and cardiovascular disease. We will launch a huge cancer campaign similar to the HIV counseling and testing campaign. Before coming to the cancer campaign, let me inform the House that the HIV search campaign that I've already mentioned, where we are targeting 14 million people for screening and testing for HIV and TB, will simultaneously screen and test 7 million people for diabetes and hypertension and put those who are found to be having these conditions on treatment. For the cancer campaign, we are currently consulting with stakeholders, including civil society organizations, who have been doing sterling work on the cancers, as well as suppliers of diagnostic equipment and cancer drugs, to co-design the cancer campaign. I'm sure it is not an exaggeration to say every member in this House either has a family member with cancer or knows somebody who has. In addition to the pain and suffering endured by people diagnosed with cancer, as well as their loved ones, there's a significant burden on the state. The diagnosis and treatment of cancer is notoriously expensive, with the cost of cancer medicines being among the most expensive in our country and globally. However, cancer need not be inevitable or a death sentence or universally difficult to treat. We can prevent many cancers and successfully treat many if diagnosed early. Our campaign, therefore, will seek in the first instance to provide South Africans with information that they need to prevent cancer, to self-screen, and to get tested for breast, cervical, and prostate cancer, for example. While there are many causes of different cancers, including genetic and hormonal factors, unhealthy lifestyle are also a major, if not the major contributing factor and associated phenomena. Hence, we need to target all the causes of cancer to ensure that we have the best possible chance of decreasing the incidence. In this instance, we shall uncompromisingly target tobacco smoking and unnecessary sugar intake. I'm sure honorable members are aware that Cabinet has approved for public participation the amendment to the anti-tobacco legislation in order to strengthen the measures. Please, honorable members, do not allow yourself to be rented by the tobacco and sugar companies to become their spokesperson here in Parliament and in our communities. We will utilize a significant part of the allocation to the Department of the sugar tax to this cancer campaign. The third thing that President Ramaphosa said, and I quote again, the time has arrived to finally implement universal health coverage through the National Health Insurance. As we acknowledge that there are those who have justifiably been impatient with the pace of implementation of NHI, we also know that there are those who are determined, for reasons of greed, that NHI will never see the light of the day. Well, for the latter group, I've got bad news. This morning, I was to present the NHI Bill 2018 and the Medical Scheme Amendment Act Bill 2017 to the Cabinet Committee for them to recommend to the full Cabinet next week, for them to be gazetted for public comment and then later sent to Parliament for legislation. However, The president said he has taken a special personal interest in NHI, and hence he instructed us to put the bill in abeyance because he's not present. He said we cannot discuss it in his absence. He would like us to wait for him. So I have just presented the medical scheme amendment bill to prepare for NHI. It is not only us at home who are working around the clock to make universal health coverage or NHI a reality. On Friday, I'm leaving to Geneva with the Deputy Minister to attend the 71st World Health Assembly organized by the World Organization. The main theme for this year is health for all, commit to universal health coverage. In this regard, I forwarded to the Honorable Speaker a letter from the World Health Organization whereby the Director General of the World Organization is requesting countries to bring members of parliament to Geneva this year because the Director General, Dr. Tedros Adhanom Ghebreyesus, would like to address members of parliament from all over the world on achieving universal health coverage and global health security. This meeting will take place on the 25th of May 2018 in Geneva, and I hope the Speaker will oblige and send members of parliament, preferably from all political parties, to this meeting. Not all of you, but at least a maximum of 4. Here at home, we'll commence with the initial steps towards the implementation of NHI, and I'm pleased to report that National Treasury has allocated funds to kickstart the process of addressing some of the challenges in the public health. This sum of 4.2 billion rand over the MTF, even if it's not what we have asked for, we understand under the present condition. And what are we hoping to do with the money? We will use it to initiate some NHI projects targeting vulnerable groups. The first thing, we have already finished screening up to 4 million kids for physical barriers to learning, which are eyesight, hearing, and oral hygiene. And about 500,000 of them have got this problem. Starting from this year, we shall start in our most disadvantaged schools, that means Quintile 1 and schools, to correct this problem. This will entail hiring optometrists for them to provide them with spectacles, audiologists to deal with their hearing, including providing hearing aids, oral hygienists and speech therapists for them. We shall start with the initial sum of 113 million rand to service these young people. Women who are at highest risk of pregnancy, we have selected 11 regional hospitals who have got very big problems in their area. We shall contract specialists from the private sector to help these hospitals. These specialists will do 2 things. 1, clinical work and training of staff. Oncology services in KwaZulu-Natal and Gauteng will receive 100 million rand to deal specifically with radiology, oncology backlogs. This is in addition to the new radiology equipment which we have bought for Addington Hospital and the old one that has already been repaired, which are about to start functioning. Gauteng has got a huge backlog, not because of their own making. It's because Mpumalanga, Northwest, and Limpopo all referred to Gauteng for radiology and oncology needs. So, honorable members, in our fight against cervical cancer, we shall also modernize and move away from pap smear to liquid-based cytology. Furthermore, using a special national algorithm, we will test at least 25,000 women for cervical cancer using the HPV DNA and progressively increasing over time the number of women who are screened in this type of test. Honorable Chairperson, South Africans are aware of the problems of mental health care in our public health system. Unfortunately, this includes the tragedy of Life is Dimeni, which stretched emotions and consciousness of the nation to the limit. The country had to extensively utilize the broad range of mechanisms available to our healthcare system and our new democracy. But today, I want to deal with 2 major emerging issues in mental health, which, if not nipped in the bud, may develop to crisis levels. The first is that legal defense in our criminal justice system are increasingly resorting to mental health problems as a reason for why crimes are committed. More and more criminal accused are being referred for psychiatric evaluation. The House may remember the notorious case of Oscar Pistorius. I'm sorry to mention that, but I have to. Since there's a grave shortage of psychiatrists and psychologists in the public sector, more and more of these criminal accused cases have to be admitted to our mental health facilities for long periods of time, waiting for mental health evaluation. Due to lack of space in these facilities, some are languishing in correctional service facilities waiting for space in our mental health facilities. As at the end of March 2018, there is a total of 1,431 criminally accused who are admitted to our mental health facilities awaiting mental health evaluation. This has resulted in clogging the criminal justice system with serious backlogs and also worsening the congestion.
Honorable, ma'am. Sorry, Minister, please take your seat. Yes,
Chairperson, I would like to ask the honourable member a question. Why is he saying
Honorable
sorry to mention
Minister, will you
Oscar
take a
Pretorius
wait,
Baditi murder
Honorable
woman?
Member. You don't do that.
Sorry.
Honorable Minister, do you want to take a question?
No. After
Oh.
I've finished.
Okay. If he has time, after he's finished, he'll take a question. Thanks.
This has resulted in the clogging of the criminal justice system and serious backlogs in our mental health facility. The second problem is that people who have been screened by nurses in our primary health care facilities and found to be having minor mental illness do not usually receive help because of shortage of psychiatrists and psychologists. The few specialists available to the public sector are concentrating their efforts on serious psychiatric illnesses. Hence, people with minor mental illness may end up taking a serious turn for the worse. In trying to solve this problem, we are going to use the NHI money given to us by Treasury to contract 52 psychiatrists and 71 psychologists from the private sector to help clear these backlogs in the criminal justice system and also for the people with minor mental illnesses. It's a well-known fact that our clinics and hospitals are also congested. This is to be expected, Honorable Member, if you consider that by 2004, we had only 400,000 people on ARVs. Today, there are 4.2 million, meaning that the figure is increased more than tenfold. Added to this is an explosion of diabetes, hypertension, and cancer. We treat more and more people in our congested health facilities, and they are getting more congested. This may sound like a contradiction in terms that we are about to launch a program that will add 2 more million people on treatment and 80,000 TB people on treatment and thousands of diabetes and hypertension in a system that I say is already overburdened. But I'm sure that none of you will ever suggest that we cannot treat more people simply because we are already overburdened. So, Honorable Speaker, what we are going to do is that we are going to use the NHI money to try and get skills in all the sectors, because that's what NHI actually means, that the citizens must have access to all the skills in the country, whether they are in the public or in the private sector. So for this reason, in the HIV/AIDS program, we shall decant 50,000 patients to 250 GPs in private practice for the treatment on ARVs between October 2018 and December 2020, and build up from there. The state will supply these GPs with ARVs and pay for their laboratory services. The only thing they will do is that we'll pay them for their service. In addition, we now have 1.3 million people on the centralized chronic medicine dispensing and distribution program, CCMDD. We want to add 1 million extra people in this financial year to try and decongest our hospitals. Honorable Chair, you know that we had an outbreak of listeriosis, and we had to recall cold meat products from Tiger Brands and Rainbow Chicken Limited. When we made the call on the 4th of March, there were 969 cases. I'm happy to announce that since the recall, we have been having less than 5 cases per week in the past 5 weeks, compared to more than 40 cases per week in the period before the recall. I would like you to join me in congratulating the National Institute of Communicable Disease, the NICD, for the sterling work they have done in isolating the source of listeria outbreak, even though some people don't believe in them. I would still want to invite, especially members of the community, to visit NICD. It's a world-class institution, and stop undermining it, please. When they tell you something, they actually mean it. The fact that we are a developing country does not mean that we don't have world-class facilities. We do. With the work done around the clock by the Emergency Outbreak Response Team, which consists of Agriculture, Health, Trade and Industry, NICD, and National Consumer Commission, supported generously by 7 experts from the World Organization, we believe we are about to see an end to this pandemic. In conclusion, let me take this opportunity to thank my colleague, the Deputy Minister, Dr. Joe Phaahla, the Chairperson of the Committee on Health, Honorable Dunjwa, and the NCOP counterpart, Honorable Dlamini, for their support and work together throughout this period. I also wish to thank our development partners for the massive financial and technical support that they've given us. Otherwise, I've just told you in the search program that PEPFAR is committed to massively contribute money. Without our development partners, we won't be able to make it. And finally, I wish to thank my team of officials led by the Director General, Ms. Malibona Matsuso, and her deputies, as well as the entire staff of the department. And I thank you all.
Thank you, Honorable Minister. Now call Honorable Dunjwa.
Honorable Chair, Honorable Ministers, Deputy Ministers, Members of Parliament, our guests, and the country at large, Molweni. The theme of our debate is intensify our efforts to improve the health of our people in honor of our lifelong contribution by Mama Albertina Sisulu. The other thing that we are, in particular myself, because on the 12th of May this month, it was the International Nurses Day, and I'm dedicating this debate to all the nurses of the country, of Africa, but in particular those in South Africa, because Mama Sisulu was a nurse. Honorable Chair and members who are standing here as the committee to say the department did table its APP and budget this month in front of the committee. The report was deliberated, findings were tabled, recommendations were made, all parties agreed and supported the report. But we are concerned, Honorable Minister, that the AG highlighted issues that are of concern to us, and those are, in particular, the findings in provinces of irregular, wasteful expenditure and accruals that are continuously being reflected by AG. And we want to then request the department to ensure that it monitors and it gives support, as it has done through the Institute of Chartered Accountants, to provinces. We are worried about the regress of 2 provinces, which is Northwest and Limpopo, but we are equally happy that the Eastern Cape and Gauteng has improved, and we want them to improve more. But Honorable Chair and members, we are very happy, Minister, that the President has taken it upon himself to ensure that the bill on national health insurance does come to this House, because if that bill is enacted at the end, we hope that we'll be able to engage with that this year, because it is going to be a game changer in the history of this country in the health sector. And we hope that our members are really going to take this very serious. We're encouraging our members, we're encouraging communities that when the process of public hearing on this bill is then being advertised, everybody must come in front of the bill and put his or her views. But we are comfortable and we are happy that at last this policy of the African National Congress, njengoba abantu besithi lo mbutho ulawulayo awukhathali nje, lo mbutho ulawulayo uyakhathala. Kuba uba lo mbutho ulawulayo ubungakhathali, besingasokuze sibe nomongikazi abavizithela izikolo, besingasoze sibe nomongikazi abaqinisekisayo into yokuba abantwana bethu bayakufumana ukutya okwendlekileyo for ukwenzela into yokuba bazokwazi ukukhula. Bekungasoze kubekho omongikazi abaqeqeshelwa into yokokuba mabaqiniseke into yokuba umama obelethayo uyakufumana ukunonophela okubalulekileyo. But Honorable Chair, we are also worried and concerned about the committee that the issue of 4 areas that are bedeviling the healthcare sector, which is HR, which is infrastructure, which is financial management, which is procurement, and we hope and we are confident that as much as it is difficult, this department is going to weather the storm. We are also worried about the program, the targets that have been taken from provinces, Honorable Minister. We hope that those, because our worry in relation to those targets that have been taken from the National Department of Health to provinces, our worry is that how are you going to have an ability and capacity to monitor and provide support to provinces, which at some point we are standing here as the African National Congress because we are leaders, and by virtue of leading the society, we are not going to run away from the challenges that we are observing and challenges that are there. On mental health, Honorable Minister, we are happy that the department is committing itself, but we want the department to take it further in ensuring that our communities are empowered in understanding what is mental illness. Kuba kaloku abantu bakuthi bebesoloko bephansi koxinzelelo lonto kuba umuntu ogula ngengqondo isidima sakhe besijongelwa phansi. Umuntu ogula ngengqondo urhulumente webandlululo ebemthatha ayokumfihla ukwenzela bangabonwa ngabantu. Siyayazi ke into yokuba lo rhulumente uthi kaloku sisigulo esifana nesiphini isigulo. Ke abantu kufuneka bafundiswe, omama bafundiswe, omongikazi baqeqeshwe ngakumbi, not only psychiatrists, but we want also health workers, nurses, every health worker to understand the importance of health, of mental illness, so that we don't again, as this country, go through what we have observed in Gauteng. We must go away. I know that people are going to come here and stand and say, you did this, you did that. It's not about that now. It's about us coming together to say, never again as this country. Kuba kaloku bathetha ngathi bebenza izinto ezibhetere. Ukuba besinalo ixesha, besinocwangcisa sitsho into kokuba zintoni ezibangela into yoba urhulumente lo ukhokelwa yi-African National Congress nale komiti esoloko ejonga ngalo lonke ixesha into yokuba ingaba le komiti isemgceni na. Sikutsho oko kuba uprogram 4 is about primary health care, and mental health is within that space of primary health care. Kuba uMama Albertina Sisulu kaloku was a very dedicated woman, a woman who made some of us to look into what is this nursing, what is entailed within nursing. For your own information, she was a midwife who will put her midwifery bag on top of her head and walk on her feet to visit, house visits. And we are saying, Honorable Minister, the community care workers, that now, we are happy that community health workers now are being looked into, but we are worried that in terms of the program, the monitoring and monitoring provinces, we are worried that that space is a space that we think that the department is not doing good. Secondly, in terms of the curriculum of the nursing profession, we want to then say, if we are to change the mindset of our communities, because at times as communities, we blame nurses. I'm saying nurses because in the center, in every health institution, nurses are in the center. And because everything, doctors give orders, who is to implement that order? It's a nurse. Who is to feed a patient is a nurse. And therefore, we do think that as we are looking into the issues of HR in particular, in that program, we think that we know that the country has got a problem of financial situation, but personally, I think that for the sector to be able to do its work, it needs warm bodies. On the basis of that, we do support this budget as the African National Congress. But we want to say, yes, we will never be apologetic in supporting, because we support, but in that support, we do monitor and ensure that our observations. Members will then come here, that will then, members are going to come here and unpack the program. You know, at times, people who don't have a thing to say, I don't want to say what the president said. I don't want to go, shut up. On the issue of
On a point of order, Chairperson.
Ma'am.
Chairperson, you were smiling and you know that there's wrong what the member is doing. Can you please ask her to withdraw?
I withdraw.
Thank you.
We do ensure, we want as the committee to say we are then committed and we are encouraged by the collaboration. In conclusion, we want to say we are encouraged by the collaboration in terms of the district health system, that the department is committing itself in these 5 years, that it will work with other programs within the Department of Health, it will work with other departments, it will work with community, civil organizations, because at the end, health is a societal matter, and therefore, if we want to ensure that the NHI succeeds, it's important that we strengthen that level of the district. But I want to say, honorable members, that as we will then be moving forward in this year, finishing this term, we want to say, as this committee, we are committed. We have been working with the department. It has not been very easy. They know, and we want to thank the support given to the committee and the office of the DG in ensuring that when called, they do come, and its entities, because its entities also are to ensure that the sector is to succeed, because without entities like the Office of Health Standard Compliance, the South African Medical Research Council, which are to empower not only the department, but also ourselves as the committee, so that when we conduct our oversight being informed with the issues that are affecting our communities. The African National Congress support the budget vote.
Thank you, Honorable Tunjak. I call Honorable Kopane.
Chairperson, I would also like to join my colleague to dedicate my speech to all nurses who sacrifice their personal lives in order to save lives. Their passion and dedication often go unnoticed, and they are often unappreciated. The reality of South Africa healthcare sector is that too many people are still struggling to access the basic healthcare system due to lack of political will to intervene. A total of 205 billion is spent on health in South Africa. This accounts to 12% of government expenditure. The problem, however, it is not about the budget that is allocated, but the mismanagement, lack of accountability, poor planning, and instances of widespread of corruption. Government is shamelessly wasting money that should have been used to provide essential services to the most vulnerable people in our society who have no other alternatives. Sadly, our provincial health departments are failing us so much that others, those who are underperforming, they are now being placed under administration. However, we all know that this is the only way to exonerate the ineffective politician from accountability. What really happens when the department is under administration? I ask this question because the Northwest that is currently under administration still fails to deliver the health services to the people. Who is to be held accountable? Is it the minister or the MEC? In most provinces, we have a major shortages of nurses and doctors, meaning that patients are compromised. For example, in Northwest, since 2016, there has been a moratorium on 1,275 vacancy posts. On an oversight at Tshepong Hospital, both medical and nursing personnel, there was overworked. On another oversight, this time it was in Limpopo Motlaba Clinic, the DA found that there is only one doctor who comes twice a month, sometimes once a month. There is no qualified pharmacy personnel. Poor nurses have to examine the patients and also to do the dispensary. The entire health department is placed under a massive strain due to maladministration and corruption. For one such instance is the overcharging and tender irregularities involving Buthelezi EMS in the Northwest and in Free State. Buthelezi EMS has netted about more than 15 million from the Free State due to backdated price increase. This after Buthelezi have been paid more than 600 million in this contract. Documents reveal how these increases were signed within 5 days. When the Free State was similarly temporarily taken out of administration by decree of the Honorable Ace Makashule. According to doctors and nurses, the service offered by Buthelezi is substandard, and it also alleged that the staff, they don't have required qualification, even an experience to deliver emergency medical care service. Furthermore, almost 40 brand new ambulance services have been idle for months in the Northwest, while millions of money is paid on the private ambulances. Buthelezi was paid 10 million monthly, while EMS was paid 4 million a month, only on 2 ambulances to transport 400 patients in Khanyisa area. The another Gupta company linked, Mediosa, was paid 30 million and further 180 million by Northwest before its mobile clinic hits the road to the rural area. Honorable Minister, you have talked about the NHI. As much as you are giving us the reassurance about NHI, but you are worried, as my colleague said, about additional, about major indicators that have been reduced in APP. And as we stand here, the pilot project are facing major concerns. Doctors and pharmacy doctors contracted to assist, they haven't been paid their salaries. And we also saw about a group of 30 doctors who are reportedly unemployed in Limpopo after their contract were not renewed in this project. It is clear that the pilot projects are failing and that the ANC proposed health insurance, it is not a feasible plan, and it is clear that it's doing more harm to the existing problem that we are having. If the department is so serious, Honorable Minister, we are pleading to you that can you please make sure that you work with the private sector in order to improve the quality of public health care, which is failing millions of South Africa. Thank you.
Thank you, Honorable Kopane. Honorable Tembegwayo.
Honorable Chairperson, arguably the biggest and the most tragic failure of the post-1994 dispensation has been its inability to look after the health of our population. The general state of decay of public health since 1994, the inconsiderate neglect by the leadership, both at provincial and national levels, of this thankless task of providing quality health care for our people, the widespread incompetence by both public servants and political leaders, all paint a very heart-rending picture of a state that does not care for the health of the people. There is no tragic an example as the case of the inability of KwaZulu-Natal to provide care for patients who have been diagnosed with cancer, who are forced to die, even in instances where they could have been treated had we had a caring government. The South African Human Rights Commission gave a detailed account of the harrowing effects of the state of oncology services in KwaZulu-Natal. And to this date, Minister, people still die in that province because of government neglect. Groote Schuur Hospital receives hundreds of orthopedic patients every year from the Eastern Cape, some who have their legs amputated because there is no orthopedic care to speak of in that province. This year, a budget of 205 billion in total for the department is presented, though the 2017 health review by the Health System Trust clearly demonstrated that the previous intervention used failed and are still being repeated despite failing. It showed that despite the growth in health expenditure over the years, poor quality primary health care services and the growing incidence of non-communicable disease crippled the system. As a result, we have overburdened public hospitals which simply cannot cope with the growing health needs of the nation. Under these circumstances, even the introduction of the NHI, which we support, will not work, Honorable Minister. We support the NHI because we are appalled by the dual health system we have in this country. The private health sector for the well-off and the pathetic public sector for the poor and mostly black. But in our doing away with the duality of health provision in South Africa, we must make sure that all hospitals have health professionals who can treat people, that all hospitals have beds and equipment needed to detect and treat diseases, that there are better equipped clinics in each and every ward that are open 24 hours a day with the necessary medication and staff too. We need to ensure that we have sufficient capacity to deliver chronic medication to the elderly and the disabled. That is the hallmark of caring nation, a nation that is able to take care of the health of its citizens. This budget, unfortunately, breaks no new ground. It is business as usual. And for that reason, EFF rejects it.
Thank you very much, Honorable Tembegwayo. I call upon Honorable Singh.
Thank you, Honorable Chairperson. Colleagues, some of our provinces are failing our citizens in terms of the provision of efficient and reliable healthcare services. By the Minister's own admission last year, and in respect of the Human Rights Commission damning findings in regard to the treatment of cancer patients just referred to now in the province of KwaZulu-Natal, the underlying causes were identified as weaknesses in provincial human resource processes and anomalies in supply chain management systems. In the Northwest Province, provincial health had to be placed under administration. Well done, Honorable Minister. It has been reported that South Africa, which has a steadily increasing demand for medical services due to growing numbers of patients suffering from a variety of illnesses such as HIV, AIDS, tuberculosis, cancer, etc., are simply unable to receive immediate medical attention due to, amongst other critical factors, the shortage of medical professionals at our public hospitals. Yet, we continue to stem the flow of foreign qualified doctors back into South Africa. Chairperson, in a member statement I delivered earlier this year in this House, I expressed growing concerns and complaints by South African students who had completed their medical degrees abroad over an HPCSA enforcement in 2018 of a 2009 regulation, which until then had not been enforced, and which now required our foreign qualified doctors to undertake internships in their country of study in order for them to be eligible to sit our South African Medical Board exams. Honorable Chairperson, colleagues, the Honorable Minister and his Deputy Minister listened. They listened to the plight of the students, and I am pleased to announce that many of those students are now sitting their board exams, those who received the letters that they should not sit. Honorable Minister, there are some good developments, but there is still unfinished business, as I said on that day. There are still a plethora of administrative and bureaucratic issues at the HPCSA that must be attended to. For example, nobody responds to correspondence. I have raised a particular issue with the Medical and Dental Professions Board on the 18th of April and have not even received the courtesy of a response. There are also issues with regard to students currently in the pipeline, and Honorable Deputy Minister knows about this, and we promise that we will engage the HPCSA and all relevant parties during the recess that we are about to have, and I hope that's going to happen, and I'm sure it will happen under this leadership. Honorable Chairperson, in terms of the Medical Innovation Bill and the subsequent regulations published with regards to the use of marijuana for medical purposes, I must commend the Medicine Controls Council on the licensing process, which I am advised is very efficient and that they are providing assistance and attending to queries. I do hear, though, that the one-size-fits-all approach to the application should rather be split between growers and manufacturers, as not all growers wish to be manufacturers, and the manufacturing license requirements on the application should then not be applicable to them. This is confusing the process and should be looked at. Honorable Chairperson, most of the recommendations by the committee, and unfortunately I don't sit very often on the committee, focus on assistance to provincial departments to improve service delivery and accountability. Honorable Minister, you and your Deputy Minister are extremely efficient in executing your responsibilities. Do not allow the poor political and administrative performance at provincial levels to give the entire health sector a poor image. Do not allow it. Finally, with the number of people alarmingly, though amongst the youth, suffering from depression and anxiety, which if unchecked leads to unfortunate suicides, the recommendation of the committee that there must be more monitoring,
Honourable
implementation
Singh,
and
your time has
evaluation of the
expired.
mental health policy has to be taken rather seriously. The IFP supports this budget vote. Thank you.
Thank you very much. Honorable the Deputy Minister.
Thank you very much, Honorable Chairperson, Honorable Minister of Health, Dr. Aaron Motsoaledi, Ministers and Deputy Ministers present, our Chair of the Portfolio Committee, Honorable Dunjwa, and members of the Portfolio Committee for Health, MECs present, all honorable members, distinguished guests, ladies and gentlemen, Dumelang. Thank you very much to the Chair for the opportunity to participate in this 2018-19 budget vote for the Department of Health. Let me also join my colleagues and comrades in dedicating this budget vote to the memory of our founding father of the democratic South Africa, Tata Nelson Rolihlahla Mandela, and Mama Albertina Nontsikelelo Sisulu. It is significant that over and above her many years of dedicated service to the struggle for freedom in South Africa, it also fell on the shoulders of Mama Sisulu to formally nominate Tata Nelson Mandela for the position of President of the Republic in this very house, in this very month of May in 1994. Honorable Chairperson, the centenary of these two stalwarts of our struggle brings special responsibility for us in the health sector. As already mentioned by the chair of our committee, Mama Sisulu was a trained nurse who used that professional skill to tend to the sick anytime when the brutal system of apartheid allowed her space to practice her profession. As a qualified midwife, she qualified at the then Johannesburg Non-European Hospital. That's what it was called in 1946. We also remember her bravery when she tried to save the life of her colleague, Dr. Abu Bakr Asfat, who was shot dead by armed assailants in the surgery where she was also working with Dr. Asfat in Rockville in Soweto on the 27th of February 1989. Mama Sisulu was prevented by the regime from practicing a career that she loved the most, but seized any opportunity to practice whenever it was possible. We honor her and also call on all our nurses and all our health professionals to follow her example of dedicated service to the people. President Nelson Mandela's love for children and his empathy for the most downtrodden is well known. It was therefore not by coincidence that one of his first major policy pronouncements after taking office in 1994 was towards addressing the plight of the poor, children and women. He did this through a policy pronouncement that all children under the age of 6 and all pregnant women would receive free services in all our public health facilities. In 1996, President Mandela entered into an agreement with President Fidel Castro of Cuba for the two countries to cooperate in the field of provision for health services. The agreement entailed, amongst others, for the two countries to cooperate in exchange for health personnel, including training and recruitment. The first batch of Cuban doctors, including specialists, arrived in South Africa late in 1996, and I was fortunate as the MEC for Health in Limpopo at that time to have the pleasure of welcoming this first batch of Cuban doctors, together with the then Minister of Health, Dr. Nkosazana Dlamini Zuma. These doctors were to make a significant contribution in our health facilities, and they are still doing so 22 years later. The following year, in 1997, we sent our first batch of a small number of students to train as doctors in Cuba. And as they say, the rest is history. The program has progressed in leaps and bounds and became known as the Nelson Mandela Fidel Castro Collaboration Program. For 15 years, the program ran on the basis of the Cuban International Scholarship, which is highly subsidized by the Cuban government and covering no more than 80 students drawn annually from 8 provinces, except for the Western Cape. In 2012, the Cuban government made available more admission opportunities under the expanded program, in which the sending country has to pay the full cost of the study. Our national department, together with the 8 participating provinces, took full advantage of this. And in August 2012, we sent the first batch of more than 900 students to Cuba. Again, as they say, the rest is history, and we today have 2,666 students studying medicine in Cuba. Over the last 21 years of this program, we always made sure that we draw these students from the rural areas and small towns and from the poorest of the poor, whose bright young boys and girls would not have had a chance to study medicine in our expensive and more urban-biased medical schools. It's always very heartwarming to attend a graduation ceremony of this program, where you see the excitement from poor rural families whose children have become medical doctors. Since 2004, when the first cohort of students graduated, more than 634 doctors from this program have joined our health service. Majority of the graduates remain serving in rural areas. Just to give an example, that from the 99 who qualified in the Eastern Cape, 82 of them are still in the province. Some of the graduates have assumed leadership roles as clinical managers, CEOs, senior medical officers, and others. A number of them have graduated also as specialists in various fields. One of the issues which we still regret as a department is that we have not utilized these graduates to the strength of their training, which is the primary healthcare area, and we have tended to just absorb them in our curative system. But we are conscious of this and will be correcting this. Honorable Chairperson and members, we are pleased to say that as we celebrate the centenary of President Mandela, we are reaching a maturation of this program. I've just returned from Cuba 2 weeks ago, where we are finalizing the return of more than 700 current fifth-year students who will be starting their final year here at home in a few weeks' time in the middle of July in our local medical schools. This is the first time that we'll be integrating a big number from the expanded program in the final year of training. I wish to take this opportunity to thank the leadership of our medical universities, the vice chancellors, medical deans, and their teams of academic and administrative leaders who accepted our persuasion to see this as an opportunity rather than an impossible disruptions. All the medical schools were represented in our meetings with the Cuban authorities on the 28th and 29th of April in Havana. We even left 4 of our top medical academics to remain for another week to interact with their Cuban counterparts and also interact with our medical students so that they could finalize the preparations. And the report which we have received is that all the engagements were very successful. Honorable Chairperson, there is no doubt that as we prepare for the NHI, we need a major shake-up of our health delivery system. We need to add more professionals, including doctors in the public health system, but we also need to accelerate transformation from curative to primary healthcare approach, both in the service and also in training. We are convinced that the major injection of Cuban-trained doctors in our system, if we handle it properly, can take us a long way in realizing the dream of improving the quality of public health. And we will be working around the clock with all the partners in the provinces and the medical schools to make sure that this integration program is a success. Honorable Chair and members, South Africa, like many developing and developed countries, remains in the grip of ever-increasing incident of non-communicable diseases. As we always emphasize, these diseases are related to our changing lifestyles. Again, just to remind us that these diseases are influenced by physical inactivity, tobacco use, unhealthy diet, and harmful use of alcohol. According to the 2016 South African Demographic Health Survey conducted by Stats SA, Medical Research Council, and our department, while overall mortality rate has been declining, there's still unacceptably high levels of communicable diseases such as HIV and TB, but more worrying is a rise in the tide of non-communicable diseases. The non-communicable diseases were responsible for over 57% of deaths, while the communicable diseases only responsible for 31%. High rates of smoking, alcohol use observed especially among South African men, with also the same population suffering from a lot of hypertension and obesity. Based on body mass index score, 68% of our women were found to be overweight and obese, compared to 64% in 2012. And in men, the figure was 31%. Again, the 2016 survey indicated that diabetes is the #1 killer. Recent studies also confirm the risk of TB being 3 times higher in people with diabetes than in the in people who don't have diabetes, and therefore confirming the comorbidity of the two diseases. We're happy that President of the Republic, President Matamela Ramaphosa, is leading the country in promoting healthy, active lifestyle in his regular morning walks all over the country. We want to encourage South Africans to follow his example, maintain it, and spread it across. This must, of course, be backed up by healthy eating, no smoking, and abstinence from alcohol or at least responsible use. The Department of Health will continue to work with various partners, including NGOs, other public bodies, including government entities and business, in promoting healthy lifestyle. We also call upon media houses to avail more free or low-cost slots on their platforms to promote active lifestyles and healthy living. But because government has a specific duty to protect the public, we will continue to strengthen regulations in this regard. These regulations will address quality of food, reducing substances such as salt, sugar, and fats. More work has been done to reduce the exposure to tobacco smoking and advertising of alcohol. As the Minister has already mentioned, we have recently submitted to Cabinet the Control of Tobacco Products and Electronic Delivery Systems Bill, which will, amongst others, legislate for 100% smoke-free indoor places and prevent tobacco vending machines in public places. This bill will also make provision for graphic or pictorial warnings on tobacco packages. It will also prohibit any form of advertising of tobacco at the point of sale. In this bill, we also include e-cigarettes in the definition of tobacco. The DTI is also tabling the National Liquor Amendment Bill, which will, amongst others, raise the age of sale of alcohol from 18 years to 21. We hope this will be able to reduce the high intake of alcohol in our society. Where diseases have already set in, it is important that it's detected early, and therefore we'll continue to roll out screening opportunities. We're increasingly making sure that our screening campaigns combine both communicable and non-communicable diseases. In other words, as we screen for HIV, TB, we also screen for non-communicable diseases. For those who finally fall ill, needing treatment, we have developed also treatment guidelines at our PHCs, which we hope will improve adherence. Those who are stable, as the Minister has alluded already, will be rerouted to get treatment closer home so that we can decongest our health facilities. So in this financial year, we hope to increase more opportunities for screening of NCDs and also chronic infectious disease, test and treat, increase campaigns of cancer awareness, detection and treatment, review our strategic plan for prevention of non-communicable diseases, increase learner screening, and also provision of assistive devices. Also increase the rollout of cataract surgery, which is a very simple surgery which improves tremendously the quality of life who regain their sight. Psychiatrists and psychologists will also be contracted to support practitioners at primary healthcare facilities. Under the Department of Health, we look after a number of public entities, and I'll just touch on a few of those. One being the National Health Laboratory Service, which continues to provide affordable, high-quality services through 268 laboratories in primary healthcare and hospitals. The NHLS has gone through managerial and financial challenges, but it is now stabilizing. We appreciate the cooperation of provinces who make full and timeous payments, although these are not always forthcoming. But when they do happen, we appreciate them. Interventions to contain costs have been introduced, such as the electronic gatekeeping system, which makes sure that only appropriate tests required by clinicians are ordered. Among some of the highlights of the NHLS, just to quote a few, 90% of CD4 and TB gene expert done expeditiously within 40 hours, reduced turnaround times of 90% for pap smears for cervical cancer, expeditious reporting on hematology and blood chemistry within 8 hours, implementation, as the Minister has mentioned, of liquid-based cytology also rolled out to 9 provinces. Robust surveillance system by the National Institute of Communicable Disease, as already alluded to as an example of the listeriosis outbreak. Also, training of pathologists, medical technologists, and also medical technicians. The South African Medical Research Council, also one of the shining examples, driving science excellence combined with good governance. Also a leader in producing young scientists, scaling up support to produce over 100 PhDs in health sciences per year. This is the target. Amongst others, it has been involved in the BRICS countries TB research network, in collaboration also with other African countries in research.
Your time has expired.
Thank you very much, Honorable Chair. We hope that the honorable members will support our budget vote. Thank you.
Thank you. Honorable Machego.
Honorable Chairperson, Honorable Minister, and Honorable members, our guests at the gallery, good afternoon. The original vision for community service was to address healthcare inequalities in rural and underserviced areas through the placement of healthcare workers in poorly capacitated health facilities. Yet rural communities are still left in community allocation. This vision has yet to materialize. Contrary to the Community Service and Internship Placement Guidelines 2017-2018 and the National Department of Health Strategy of Human Resources for Health South Africa, Strategic Priority Number 8, large numbers of community service officers are concentrated in urban areas. In the Eastern Cape, there has been noticeable evidence of regression of this service. Hospitals which rely solely on community service officers for the provision of services such as occupational therapy, physiotherapy, do not receive any community service therapists. Accordingly, we suggest the following: that the process of allocation must be transparent and data pertaining to the distribution of community service officers across all provinces must also be made widely available. The strict and urgent enforcement of compliance to the Department of Health policy on the allocation of community service officers in rural areas. Resource prioritization must occur in a manner that favors rural and underserviced areas. Community service officers must be made to realize that community service is a duty, and they should not be granted the privilege to decide where they would like to be placed. Sufficient work-related support should be given to community service officers. Honorable Minister, one of the historic hospitals, Victoria Hospital in the remote area called Alice, will be marking its 120th anniversary this year. It was established in 1898 through the Lovedale Missionary Institution. It was the first hospital in South Africa to train blacks as nurses. Its most famous graduate, Cecilia Makiwane, who qualified in 1907 to become the country's first black nurse. This hospital has a deep connection with the Fort Hare University through academic programs. It earned itself a national reputation during the 1930s and 1940s as a specialist orthopedic facility. In 1940, the McVicar Hospital was opened on the Victoria ground to become the first South Africa's tuberculosis facility for Africans. Accordingly, as we mark this important milestone, we invite the Minister to consider making this achievement a memorable one that will sustain the legacy of Cecilia Makiwane and many others who became a beacon of light for the people of Alice and the Eastern Cape, especially that it is Mama Sisulu's centenary, who also was a nurse herself. The best that can be done is to improve the infrastructure of Victoria Hospital and build new and bigger wards to respond to the ever-increasing demands of a growing population. Honorable Minister, the Bedford Orthopedic Hospital in Mthatha also needs a lot of attention, especially increasing the wards, as it is the only facility which is an orthopedic hospital serving all the areas across the Kai River. Honorable Minister, we commend the improvements that are taking place at Frere Hospital. All we request is more staffing and more doctors. That, incidentally, was my hospital when I trained as a nurse. To conclude, Honorable Minister, we request that you consider these important requests. We support the budget. Thank you.
Thank you very much, Honorable Majege. Honorable Vessels.
Honorable House Chair, public health care is deteriorating daily and people are suffering. The solution does not lie in Cuba and it does not lie with the NHI. The solution lies to have a caring government. Our provincial hospitals have become mortuaries instead of places of healing. No matter how efficient you as minister are, your provincial counterparts' inefficiency are killing patients. We commend the many nurses and doctors and other healthcare professionals who work selflessly under extremely difficult circumstances in hospitals and clinics, where safety is of concern and where essential equipment and medicine lack. Chairperson, the crisis facing our healthcare system is not due to budget constraints, but it is rather due to maladministration, looting, corruption, and a complete lack of consequences for transgressions. CEOs are appointed of hospitals who do not meet the requirements set by the minister, but nothing happens. Let me also give you an example of how government are failing the people. A 6-year-old girl was severely raped outside Kroonstad a few years ago. Police took her to a nearby hospital, the provincial hospital. Medical staff gave her an aspirin and told the police that there's nothing wrong with her. The police could see that the girl was in excruciating pain and took her to Bongani Hospital, nearly 80 kilometers away. That girl was screaming all the way from the pain she suffered from. At Bongani Hospital, she received emergency surgery. Chairperson, that is the problem, that we do have hospitals where staff are not trained and where they do not have the dedication to actually act in the best interest of our patients. We have administration who are only interested in themselves and not in the actual plight of the patients out there. Something is seriously wrong. The solution cannot lie with national health insurance, Honourable Minister. The prerequisite for national health insurance is a public healthcare system that works. Implementing NHI will only severely cause a more severe plight on the public healthcare system and will not solve the problems. If we do not address our provincial departments that are maladministered, where maladministration takes place and where it's a complete mess, NHI will never work. The money is being stolen. The money is not being procured to actually care for the patients. We need a caring government, and currently we do not have one. Only a caring government will address public health care, not Cuba, not sending students to Cuba, and not the NHI. Start addressing and cleaning your own house. Look at your provincial MECs who do not care about their provinces and only care about themselves, who procure contracts to the Guptas instead of actually looking at what is the best for their provinces. At clinics and provincial hospitals who are deteriorated in terms of infrastructure, and where they do have the money, they do receive the grants, but they don't spend the grants. Address that, address your own party, clean your house, and then the people will have better health care. I thank you.
Thank you very much, Honorable Vessels. Honorable Dudley.
Thank you, Chair, Honourable Minister. The ACDP is concerned that health services throughout the country are not keeping up on an equitable basis with new technology, and that many health facilities offering maternity and CTOP services do not have basic ultrasound equipment or suitably trained staff for that matter. Now, much is being said in other departments about keeping up with the technological revolutions that the world has experienced and is continuing to experience, and yet the most scientifically based sector traditionally is arguing that basic technology like ultrasound equipment is not necessary in all health facilities. Maternal and child deaths, which are still a concern in South Africa, have received significant attention, especially in view of the Millennium Development Goals and now the Sustainable Development Goals. And what has been noticeable and a little odd is that stillbirth targets were omitted from the MDGs and remain absent from the SDGs. It is peculiar for many reasons, but not least of all the fact that giving birth to a stillborn infant is one of the most heartbreaking and tragic events for any parent and their family. These babies die either during pregnancy or during the process of giving birth. In a ranking of stillbirths in 193 countries by the Lancet Medical Journal, South Africa was placed at 140. Now, the causes of stillbirths are closely connected to the same influences that affect maternal and newborn mortality, which are often identified too late, if at all. And while more research is necessary to understand the causes of stillbirths before labor, we do know that cleanliness, infection prevention, reduced waiting times, drug availability, and improved staff attitudes have been identified as important factors in improving management of labor and delivery. And the ACDP calls on the Minister to take radical steps to improve management of labor and delivery. We're calling on the department to recognize that significantly reducing child and maternal mortality and even stillbirths will need more than just increased access to abortion, and to provide women with scientific information about their pregnancy. Make ultrasound equipment available in all health facilities. Train health professionals in line with this technological age that we live in. This must be a basic norm. The World Health Organization, whose guidelines and instructions are followed so closely by our health department, according to their own testimony, has stressed the importance of ending what they call preventable deaths in reference to stillbirths and maternal and child mortality, and yet oddly insists that ultrasound equipment is not needed where maternity and CTOP services are provided. The ACDP calls on the department to ensure the training of healthcare workers includes the importance of counting every birth and every death. Healthcare workers are well placed to assist in providing relevant help and information, as the grieving from a stillbirth or CTOP is often left to the mother to shoulder alone. The ACDP calls on the Minister to ensure budgets extend to counselling of women experiencing stillbirths and termination of a pregnancy which prevents a live birth. The ACDP will not support this budget, which is discriminatory and not prioritising adequate protection and services for moms and their babies. I thank you.
Thank you, Honorable Dudley. I call upon Honorable Nkonzo. Oh, I'm told that this is his maiden speech. So let us not disturb him. Let us give him a chance and listen to him.
Honorable Chair, the ANC has declared 2018 as the year of celebrating the lives of our icons, Tata Nelson Mandela and Mama Albertina Sisulu. The year of renewal, unity, and jobs. While we reflect on the life of Mama Albertina Sisulu in particular and her contribution to the health sector, we are thus making a clarion call to all South African health practitioners, professionals, people with expertise in this emotive sector to intensify efforts to help improve the health of our people in honor of her lifelong contribution. The National Department has its entities, and these play a significant role in this regard. For instance, one, on the National Health Laboratory Service. This entity supports the department by providing cost-effective diagnostic laboratory services to all state clinics and hospitals and services more than 80% of population through a national network of 268 laboratories. Its specialized divisions include the National Institute for Communicable Diseases, the National Institute for Occupational Health, the National Cancer Registry, and the Anti-Venom Unit. South Africa, through the work put in by the NHLS, has become the first country to have 2 laboratories awarded first star level out of 18 countries, audited by the African Society of Laboratory Medicine, using a World Health Organization accreditation system. The NHLS has been successful in the rollout of the laboratory information system in all its labs across the country. This has resulted in an integrated management system of all lab data. The NHLS corporate data warehouse has resulted in the development of the first national CD viral load monitoring dashboard, which is an online tool to monitor CD4 count and viral load in HIV positive patients. When the country was recently plagued with the listeriosis outbreak, it was through the efficiency of the NICD, the scientists and environmental health practitioners who worked tirelessly during this period. The NICD was able to identify the source of the outbreak, which was confirmed to be the Enterprise Food Production Facility in Polokwane. Chair, we acknowledge and recognize the historic challenges that have existed in the NHLS, particularly on its funding model, governance, and leadership. However, the NHLS has worked on these challenges, and the department has ensured that the NHLS governing document, the NHLS Act, is amended to address these challenges and ensure that the entity operates optimally. The ANC is happy to announce that the committee has already adopted the NHLS Amendment Bill, and we are confident that the entity will be able to fulfill its mandate. Number 2, on the South African Medical Research Council, the SAMRC is the custodian for medical research in South Africa and is the centrality of scientific excellence, with intramural research being prioritized so as to maximize the impact on the Sustainable Development Goals. The total budget allocation for the SAMRC in 2018-19 is 1.1 billion. The SAMRC's complete budget comprises two components, namely the annual baseline grants from the NDOH and donor funding. The ANC commends the SAMRC on the several new initiatives they plan to undertake during this financial year, some of which include improved funding of intramural units through the establishment of an intramural research fund focusing on emerging and previously disadvantaged individuals, and expanding its African footprint through collaborative projects with scientists in African countries which complement existing work in Rwanda, Ghana, Kenya, and Zambia. Number 3, on the Compensation Commission for Occupational Diseases in Mines and Works. As ANC, we welcome the establishment of one-stop service centers in an effort to decentralize services for current and ex-mine workers, especially in labor-sending areas within South Africa and beyond our borders. The CCOD has experienced challenges in the past and as a result had not submitted their financial reports. This has crippled the CCOD's ability to pay in claimants dating as far back as year 2000. The report to date, however, is that the CCOD has addressed this challenge in their submission of its 2012-13 and 13-14 financial statements and annual reports to the Auditor General, and their 2014-15, 15-16 reports have recently been submitted. We, as ANC, encourage the CCOD to continue with the submission of the outstanding reports. 4, on the Office of Health Standards Compliance, the ANC commends the OHSC for their actions towards completing the norms and standards to be promulgated by the Minister of Health. 5, on the South African Health Products Regulatory Authority, the ANC welcomes the establishment of this authority and urges SAPRA to accelerate the appointment of its financial officer and technical staff to address the staff backlog and ensure that the vulnerable and poor are not burdened with increasing costs of medicine due to fee increases aimed at revenue generation. In conclusion, House Chair, in echoing the sentiments of the ANC's Ready to Govern document, we as ANC are preoccupied with the need to overcome the legacy of inequality and injustice created by colonialism and apartheid in a swift, progressive, and principled way. We are confident that the realization of a true, united, non-racial, non-sexist, democratic, and prosperous society will not be a pipe dream. As the President of the Republic, President Ramaphosa, has reminded us in his SONA, I quote, we are at a moment in the history of our nation when the people, through their determination, have started to turn the country around, close quote. That determination must transcend into our daily lives and radically transform a once unjust, unequal sector. In the spirit of Tumamina, and in the words of our former state president, Nelson Mandela, open quote, for with freedom comes responsibility, I close quote. We urge the department and all South Africans at large to heed the call made by the president during his SONA, and for each and every one of us to be willing and agreeable to say, Tumamina. I thank you.
Thank you very much, Honorable Nkonzo. Honorable James.
Honorable Chairperson, nurses are on the front line of healthcare in South Africa, and yet government gives them little resources to carry on their duties while they tirelessly serve the South African people. There is a major shortage of nurses in South Africa, which is worsened by the various challenges nurses face on a daily basis. It should therefore be no surprise that various clinics in South Africa are run only by nurses. Large segments of our population in both rural and urban areas rely on nurses for healthcare, and in many rural areas, nurses are the first and only point of contact for healthcare. A DA government would prioritize the filling of vacant posts and start to address the various inadequacies in relation to the training of nurses on the new basic nursing qualification program. In December 2017, it was revealed that the government intends to introduce a new HIV/AIDS and TB treatment combination in 2018 that will assist in decreasing the spread of the pandemic. This had been announced by South African National AIDS Council Chairperson and then Deputy President Cyril Ramaphosa at the World AIDS Day commemoration. During the State of the Nation address, President Ramaphosa said that, I quote, "This year we will take the next critical steps to eliminate HIV from our midst by scaling up our testing and treating campaign," close quote. No HIV treatment and testing campaign have been rolled out as of yet. The 2018 Global Competitiveness Report shows that South Africa still has the highest number of tuberculosis incidents out of all the participating countries. This is also coupled with some of the highest prevalence of HIV and AIDS. We are also placed in the top 10 worst performers when it comes to life expectancy. This shows a failing health system, and we as a country should be ashamed. Furthermore, the President promised that in the next 3 months, a huge cancer campaign will be launched. As of yet, no campaign has been launched, although Minister Aaron Motsoaledi said the campaign would include talking about testing, early detection, prevention, and treatment. Patients, especially in KwaZulu-Natal, Gauteng, and the Eastern Cape, still have to wait months to receive treatment. In the case of aggressive cancer, this is a death sentence in many cases. Various machines used for the treatment of patients are still faulty, broken, or haven't been replaced. There has been no success in addressing the oncology crisis faced by the country. In addition to this, people are dying queuing in lines at the clinics to receive medical attention. Limited progress with the implementation of the Ideal Clinic program is a huge concern. The vast majority of South Africans do not benefit from private healthcare and depend on overburdened public clinics and health institutions to assist them in times of need. In a written reply to the DA, Minister of Health admitted that our health facilities struggle to keep appropriate patients' records or to retrieve patients' files when patients visit facilities. We have a situation where patients migrate from one health facility to another to receive the same treatment, which was given in a different health facility a day before or sometimes even just hours before. The government can't even keep proper records. Our entire public health system is in shambles. Ambulance services remain a major challenge, especially in the deep rural areas. This means that patients have little chance of receiving ambulances in times of emergency. We are denying South Africans their constitutional rights, Minister. Our people deserve better. And this budget does not address this major failure in the health system. The DA is the only party that can provide the poor
Honorable
and
James.
vulnerable with quality health facility services.
Honorable James, your time is up. Thank you. Honorable Imam.
Thank you, Honorable House Chair. On behalf of the National Freedom Party, we support the BRR report to be tabled here today. Allow me also to commend the department and particularly the Minister and his team for the hard work he is doing in trying to ensure that the national health insurance, the universal health cover for all South Africans, the poorest of the poor, becomes a reality. A very difficult environment indeed, having inherited a very challenging healthcare system in the country as a result of the apartheid policies of providing quality healthcare to a few at the expense of the majority of our black people. Adding to this, Honorable Minister, is the limited power that national departments or ministers have, the mandate being in the provinces. Now, Honorable Minister, I stand here very disillusioned today, very unhappy. And I'm going to tell you why I'm so disillusioned and so unhappy. While health is supposed to be the mandate of the national department, our people in the Western Cape are going through a crisis. Now, let me start off by telling you, the list is endless. The day hospitals have only one doctor and turn away people daily. Patients come in at 5 o'clock, and when there's emergencies, they are turned away. They must come the next day. If there's not enough, they go the next day and they continue. Some of them are never, ever seen to at all. Clinical nurse practitioners are required to perform duties of a doctor even though they've only had 5 days of training. Patients come at 5 and go home at 4 o'clock every day. Clinical nurse practitioners diagnose and prescribe medicines to mental patients. They work on their own because psychiatrists come twice a month only for 4 hours. They've been given instructions at all these clinics and day hospitals to close the taps. They've been told not to wash their hands, to rather use the antiseptic. Let me also tell you, what I'm saying to you is a fact. You'll never ever admit that. There is a massive stock out of medicine shortages. One of them is what you call the Phenogan. They are changing the medicines of the patients, Minister, which is resulting in people becoming sick. They've been told to minimize the number of x-rays. Despite every patient that comes to the clinic must be tested for TB. How are they able to do this? Let me also tell you, listen to this one, listen to this one. The clinics and day hospitals have been told to only flush the toilets after every 5 patients have used them. And the term they are using, that when the water is mellow yellow, only must you flush the toilets in order to save water. That is how poor managedly the Western Cape is, and specifically the healthcare system. All right? Now, let me also tell you another challenge we have, which affects the constitutional right of people. Even the dead can't die in peace in the Western Cape. Because the forensic laboratories, and you know it's a religious obligation for some religions to bury their dead ones immediately. The waiting list in the Western Cape, it sometimes goes up to a week before you can get that body released. That's how bad it is in the Western Cape. But they spend more of their time. And just to allude to one thing, Honorable Minister, for the benefit of honorable vessels, Cuban doctors, that South African trainees in Cuba, follow the curriculum provided by the Department of Health here. So what you said on that side is absolutely not true. You are misleading the people in saying they are not trained to perform. Indeed, they are trained to perform. But this province has not sent a single person to become a doctor. Not a single one. Only province. Yet they have a crisis in healthcare here. The National Freedom Party supports the report tabled here today.
Thank you very much, Honorable Madisha.
Thank you, Chair. The provision of healthcare services plays a vital role in giving effect to our Bill of Rights, be it access to healthcare or that no one may be refused emergency medical treatment, or the right to life, or the right to have one's dignity respected and protected. And yet, all of these rights, instead of being respected, promoted, and fulfilled, are being disrespected and violated on a daily basis within our state health care system. And I shall give you areas and examples. Our state health care services are failing, and the root cause lies in bad governance and unethical leadership. A tragedy is defined as, I'll quote, an event causing great suffering, destruction, and distress, such as serious accident, crime, or natural catastrophe, unquote. The life Esidimeni, a tragedy in Gauteng, was neither an accident nor a natural catastrophe. Its genesis and consequences were and are criminal. Like Nkandla and like state capture, it represents the tragic consequences when ethical and responsible leadership and the entire system and values that inform and underpin good governance fail, and a culture of impunity reigns supreme. Chair, in KwaZulu-Natal, many have suffered and hundreds have died due to the crisis of, in the provision of oncology services. An average waiting period for a patient to be seen by an oncologist of 5 months and an 8-month waiting period for radiography constitutes a life sentence to many needy patients. The South African Human Rights Commission found that both the national and provincial departments of health were guilty of infringing upon the constitutional rights of cancer patients in KwaZulu-Natal. Chair, warning signs are flickering in Gauteng in respect of the provision of oncology services despite denials of an impending crisis. And I'm aware that Welkom in the Free State is serviced by one oncologist who visits, but not frequently. We may well be facing an impending national-wide oncology crisis. In Mpumalanga, the South African Medical Association claims that staff shortages, a lack of adequate medical equipment, and the safety of medical staff in Mpumalanga's public hospitals is severely impacting the quality of health care. In Northwest, we have witnessed violent and unbecoming protests by hospital staff, including the forced closure of facilities.
Honorable Madisha, your time is up.
Chair.
Thank you, Honorable Madisha. I'll now call upon Honorable Wilson.
Thank you, Chairperson. May I open to say our thoughts are with the 8 staff members of the Mediclinic Mill Park who we assisted after an awful accident on the N1 on Saturday. 2 were critically injured. May your recovery be speedy. Chair, the Department of Health has flatlined, and its chances of resuscitation anytime soon is very unlikely. You would have to be comatose not to see a disaster looming. The provinces went into the new financial year with 13.8 billion rand of accruals, the bulk of which is from the Gauteng province. Over 1 billion rand is recorded in irregular, fruitless and wasteful expenditure. You cannot deliver effective health services or care for the poor and vulnerable when at the outset of your financial year, monies allocated are spent on accrued debts or will be lost to irregular expenditure. The 134 million, or 88% of the budget being transferred to the provinces cannot be used to upgrade services. It's going to debts and staffing. The health system faces collapse. The department faces 28 billion rand in malpractice claims. And this is set to escalate as the health facilities in South Africa continue to disintegrate, erode, and attract fewer health professionals who cannot work in such appalling conditions. Nowhere in the budget is provision made for such claims or even a portion of them. With entities such as the National Health Laboratory Services, NAPRA and the OHSC all reporting challenges of insufficient and inappropriately qualified experts in various fields. Consultation and external contractors' costs have increased from 179,000 to in excess of 25 million in the 2018-19 year, and this is expected to increase to 75 million in the 2021 year. Agency support and outsourced services have escalated from 1 million to 25.8 million. Explanations for such astronomical increases are vague, and a clear indication that the Department of Health and its entities are in need of more intensive care. It is incomprehensible that the budget for radiation control and health technology has faced a massive cut of 90% in the 2018-19 financial year. Given the current oncology crisis in South Africa, this is very troubling. No explanation for this has been given. Another clear indication that the Minister and the governing party give little priority to a large part of the South African population who are ravaged by disease. Budgets for computer services and compensation of employees have also faced massive cuts. Where does that leave the health system? Failing. The Compensation Commission for Occupational Diseases has only just presented its 2010 to 2012 annual reports to the portfolio. Justification given to the committee was shortage of administrative personnel to capture data. Really? 8 years to fix that? Minister, we are not sure what you have been doing since your appointment, but it would appear that you have been altogether out of touch with the terminal condition of your department. Minister, you cannot deliver the NHI. It's impossible to deliver with what? There is no infrastructure, professionals, medicines in the majority of clinics or hospitals. Emergency services are in a terrible state and severely under-resourced. Where are the new clinics mentioned in the midterm budget and the new hospitals? We've revitalized, but we haven't built. There's a severe shortage. Minister, may I encourage you, please, to spend time in the Western Cape Department of Health. It is the only province that is functioning properly, with a good track record and a great audit report. Not surprising, though, it is managed by the DA. I thank you.
Thank you, Honorable Wilson. Honorable Masalela.
Now, thank you, Honorable House Chair, Minister and Deputy Minister, and all ministers present, comrades and friends. Health is not everything, but everything is nothing without health. Those were words from the Indian spiritual master and author of System Yoga Daily Life. Everyone will probably agree with him that health is human beings' first happiness, and that is the essence of it all. Should we fail to take care of our health, we will lose our happiness as well as our wealth. Our health is mostly influenced by the food we eat, our way of thinking, our relationship towards ourselves and the world, and the influence of the environment. Section 27 of the Constitution enjoins us to ensure that everyone has the right to have access to healthcare services, including reproductive health care. It stipulates that the state must take reasonable legislative and other measures within its available resources to achieve the progressive realization of these rights. This constitutional imperative therefore urges government to ensure that there is universal access to health services. To achieve universal health coverage, institutional and organizational reforms are required in order to address the structural inefficiencies, ensure accountability for the quality of healthcare services rendered, and ultimately to improve health outcomes, particularly focusing on the poor, vulnerable, and disadvantaged groups. The current two-tier system, which we inherited, is not only inequitable and inaccessible to the large portion of South Africans, but the institutions in the public have suffered an underfunding, human resource capacity, deteriorating infrastructure. There has however been improved health access, which has overburdened the public health system. The situation is further compounded by public health challenges, including the burden of diseases such as HIV and TB, shortage of key personnel, and the dramatic growth of non-communicable or lifestyle diseases. Regardless of all these challenges, the ANC government is responding with far-reaching transformative plan to revitalize and restructure our healthcare system, which include the following. Firstly, fast-tracking the implementation of the National Health Insurance, which will eventually ensure access to healthcare as a right, social solidarity, equity, healthcare as a public good and social solidarity, equity, healthcare efficiency, affordability, social investment, effectiveness, and appropriate level of care. The NHI is now undergoing the second phase of implementation, though the extent of the reform intervention for the first phase is still unclear as the department is still busy with the evaluation process. The annual performance plan is, however, silent on the delivery timelines in relation to the setting up of the fund, regardless of the pronouncement made in 2017 budget by the Minister of Finance when he said, and I quote, "In the next phase of the NHI implementation, an NHI fund will be established," close quote. According to that statement, the initial focus of the fund will firstly improve access to common set of maternal health and maternal services and family planning, as the minister has already alluded to expand the integrated school health programs, which the minister has indicated that this will include the provision of spectacles and hearing aids, and lastly, the improvement of services to people with disabilities, the elderly, mentally ill patient, including the provision of wheelchairs and other assistive devices. We are, however, pleased to learn that, as you have indicated, Minister, that the NHI legislation is currently underway, as promised by the President during SONA, that the bill will be tabled before Parliament. We are awaiting for it. There has been an observation that the bulk allocation in Program 2, which is your national health insurance, health planning and systems, flows towards consultancy fees. There is therefore a need to build internal IT capacity as an important strategic goal going forward as the department rolls out its multiple e-platforms to reduce the reliance on consultants. There is welcoming efforts that the department has made in strengthening the fight against HIV and TB through what Minister you've just announced, the systematical implementation of the 1990 strategy, the non-communicable disease, by launching a nation campaign against cancer and intensify our efforts to reduce smoking, alcohol, and sugar consumption. There is also a need to improve our human resource management at state hospitals and strengthening coordination between the public and the private sector. The department has thus far managed very successfully to deploy more than 3,519 ward-based primary health care outreach teams. These teams are fundamental in making sure that we implement primary health care. And primary health care, as you all know, are the cornerstone of healthcare delivery in South Africa and are therefore very fundamental building blocks towards the NHI. The health status of South Africans is rapidly improving. Life expectancy has increased according to Stat SA in 2017, which shows that life expectancy has improved from 59.6 in 2009 to 62.5 years in 2014 to 64 years in 2017. These represent a male life expectancy increase from 55 years in 2009 to 61.2 years in 2017, while female has increased from 58.7 in 2009 to 66.7 years in 2017. That's a great achievement thus far. We are therefore confident that the department is on track and will be able to achieve the MTSF 2019 targets of 65 years. The government's consistent effort to and focused plans to improve maternal, child, and women's health have yielded positive results, in which is consistent with the goals of the NDP 2030 vision. According to Stats SA, infant mortality rate improved from a baseline of 42.8 deaths per 1,000 live births in 2009 to 36.6 deaths in 2014. To 32.8 deaths in 2017, while the under 5 mortality rate improved from a baseline of 63.3 deaths per 1,000 live births in 2009 to 49.1 deaths in 2014 and 42.4 deaths by 2017. The number of people who tested for HIV has increased exponentially from a low base of 1.5 million in 2009 to 14.2 million in 2016. The rapid scale of ARV services has resulted in significant increase in the number of people receiving ART in 2009, which were at 1.1 million were initiated and now has increased to 2.9 in 2014 and then 4 million in 2017. There is an intention, according to the annual performance plan, to make sure that there is an additional 2 million more by 2020. We welcome the department's plan to screen and test, as the minister has indicated, 14 million people annually on HIV and TB-related diseases. We, however, wish to encourage the department to continue with its efforts of directing most of its focus and energy on preventative measures so that we're able to prevent the recurrence of these diseases. We also want to commend the department on the TB treatment outcomes, which have shown consistent improvement. The success factors for the impressive TB outcome indicators include improvements in the effectiveness and efficiency of the routine TB control program through interventions such as intensifying the identification of TB patients, ensuring that TB patients take and complete their treatment, continuous training of TB tracing coordinators, effective tracing of TB patient and suspected TB patients, and improving the functioning of the MDR TB control program, including earlier initiations of treatment and decentralized treatment. In relation to infrastructure, we wish to commend the department for its effort of repairing and refurbishing of 150 facilities in the NHI districts, and its intention this financial year to maintain, repair, and furnish 125 facilities in NHI districts, construct and revitalize 2 hospitals, and construct and revitalize 20 clinics and community health centers. Despite these efforts, we are, however, concerned that facility revitalization grant and the indirect component of the National Health Grant is being reduced by 511 million and 309 million respectively for the 2018 MTF, as this is likely to affect departmental infrastructure delivery program. We wish to encourage the department to redirect conditional grants allocation towards maintenance of infrastructure and equipment in order to meet the target of ensuring that all facilities comply with the ideal clinic model. There is also a need to develop systems that ensures that provinces provide sufficient budget provision for absorbing qualified health professionals, special nurses and doctors, as their human capital plans. This will be in line with the preamble of the National Health Act of 2003, which says, as amended, to promote a spirit of cooperation and shared responsibility among public and private health professionals and providers and other relevant sectors within the context of the national, provincial, and district health. There is therefore an urgent need to pay special attention on the major issues that are currently bedeviling the public health system, which are the inadequate infrastructure for mental health services, which is impacting negatively on the quality of services, limited progress towards the implementation of the ideal clinics, which according to the report is only 1,227 primary health care facilities have achieved an ideal clinic status, as opposed to the 2,823 target in 2019. There is a need to address the immense financial pressure that the public health is currently experiencing, which include the issue of the 16 billion accruals. Despite this improvement, we must understand that the rates are still unacceptably high. The mortality rate is still unacceptably high for a country like South Africa. Premature deaths, injury, and a high absenteeism and presenteeism due to poor health status contribute to low productivity at work and therefore slow economic growth. It must, however, be noted that poor health outcomes are not exclusively a reflection of health system alone. There are vast range of generic socio-economic and behavior factors that influence a population health status, and many of these factors are the ones that drive poor health outcomes in our country. These include issues such as poor housing and access to water and sanitation, high level of indoor pollution associated with fires and cooking, poor diets, and a high level of consumption of alcohol, tobacco, and sugar beverages. According to global statistics, South Africa among the highest consumers of alcohol. According to statistical update from the WHO, shows that in 2015, pure consumption per liter in South Africa is at 11.5 per capita per year. the harmful effect of alcohol consumption in relation to health results towards violence, death, injuries through reckless driving, fatal alcohol syndrome, risk behavior leading to the transmission of infectious diseases such as HIV and AIDS, neuropsychiatric disorder, as well as various cancer diseases, and has the ability to destroy and disrupt communities and families. We welcome government's efforts to reduce sugar consumption through the implementation of the sugar tax that has just been introduced this year. Coming to the issues that some members have raised, we want to assure Minister that in the portfolio committee, there's never been anyone who has got a different view. They are standing here and grandstanding because they want to present their political views. But at the portfolio committee level, no one has ever raised a matter that they are raising today. In relation to what Honorable Douglas raised, it's unfortunate that she has raised the matter in the manner that she has raised it. Because in the portfolio committee, there was no indication that ultrasound system is not necessary. But we said it was not necessary as a precondition for a woman to take a decision to abort. We never said it's not necessary for it to be used. No, we never said that. So you must be able to, the Honorable James, you must go and read your APP on page 56 around the issue of EMS. It's there in details. Honorable Ulanane, you must go and read your...
Honorable Mahlalela.
You must go and read on page 56 as well, Honorable Listen, your APP on the question of the
Honorable Mahlalela.
oncology services. Is there in the document. You must go and read.
Now call upon the Honorable Minister of Health, Honorable Dr. Motsoaledi.
Thank you, Honorable House Chair. And thank you, honorable members, for this very lively debate about this very important debate on budget debate on health. Honorable Kupan, the issue of corruption, yes, Honorable Kopani, the issue of corruption is not in any of our plans. It's not in the white paper on NHI. It's not in any of our APPs. It's a crime. And we are standing here today to tell you, anybody, regardless of which party they belong to, including my own party, if they were found to have stolen from the poor, they must be arrested. So yes, they must be arrested. So don't think we're going to run away from this issue of Medios or Buteles or whatever. We have already submitted it to the Hawks. And last week in Northwest, I met the head of the Hawks and SIU and asked them, how far are you? You need to arrest people who steal money for healthcare. So it's not, you are not going to use the reason of corruption. The reason of corruption of why they cannot be NHI. It's a crime. It's stealing from the poor and people must be arrested. We agree on that one. Honorable Majeke, that's a brilliant idea about Victoria Hospital and the relationship with Cecilia Makiwane. We'll really look into it. It's a very exciting proposal we make and we welcome it. And that vessels, hey, where do you start when people behave like this? Because this issue is repeated many times, that our solutions for health is not universal health, it's not NHI. The whole United Nations, after thorough research, have already said and said this is the solution for the world. And they put it as one of the 17 sustainable development goals of the world. And they said without it, there will never be development around the world. Now I am hoping those who are still not believing, I'm hoping and praying, Honorable Chair, you must ask the Speaker, when the Speaker responds to the Director General of the World Organization to send members of Parliament to Geneva to listen to the DG, please take them along, because they will arrive there and get some education. But let me tell you exactly what they are scared of, not that they don't understand. This is the copy of The Economist. Not a very radical publication, The Economist, of April 28th to May the 4th. It says universal health coverage within reach worldwide. The case for universal health coverage is a powerful one, including in poor countries. And now let me tell you what Honorable Wessels and his ilk are scared of. And they put it very clear here. They are not beating about the bush. They say there's no hiding that public health insurance schemes require the rich to subsidize the poor. That's what you are going to do. Yes, that's what they are going to do. It's written here in The Economist. The rich must subsidize the poor. And we are not going to apologize for that. The young must subsidize the old. And we are not going to run away from that. The healthy must subsidize the sick. And we are not going to run away from that. Now, if healthcare systems of the world were fixed and doing well, we won't need universal health coverage. No, you can't say, no, fix the healthcare system before NHI. If we fix it successfully, and we are successful in that without NHI, then we don't need NHI. You will need it because the healthcare system needs to be fixed. That's what universal health coverage is all about. Honorable James, I actually hate, unfortunately, you are pushing me into that, of trying to compare our provinces, but you do that all the time. And come and attack us, yes. When the HPSA accredited posts for internship, provinces are supposed to create those posts. Do you know that here in the Western Cape, in this year, they created only 56% of the accredited posts. Yes, Gauteng filled 86, KZN 84%, the other province 100% of the posts were created. Here only 56. Out of the 700 Cuban students who are returning, they are taking only 40.
Honorable Minister.
Honorable Wilson, just one advice. You came to a wrong place. Go and ask for a job in the soapies. That's where you belong. That's all I can say for you.
Your time is up. Thank you very much, honorable members. This concludes the debate and the business of this mini plenary session. The mini plenary will now rise. Thank you very much.